Hi, everyone, and welcome back to Burn the RuleBook podcast. This is the podcast where we break down everything you were never taught about menopause, mental health, and relationships one truth at a time. I'm Rachel Boyle, a licensed couples therapist, sex therapist, and certified menopause specialist. This podcast helps you understand what is actually happening to your body, mind, and relationships, and gives you real tools to move through life with clarity, calm, and connection. Let's get started.
Hi, everybody, and welcome back to Burn the RuleBook podcast. Today, we have a very special guest. Her name is Dr. Harita Raja. Dr. Raja is a board-certified psychiatrist who specializes in women's mental health. She is a reproductive psychiatrist, which means that she understands the intricacies of psychiatric problems that occur before, during, and after pregnancy and their treatments. She also has expertise in the hormonal changes that occur from menses to menopause. Dr. Raja founded Bethesda Women's Mental Health to provide women with a place to obtain compassionate and knowledgeable psychiatric care. She works closely with patients, their loved ones, and their providers to find the best treatment plans. Welcome to the show.
Thank you so much.
Okay, so tell us a little bit. How did you get started? How did you get involved in this whole, women's health, women's hormones?
Yes, I call it. No, I was actually training at Georgetown for psychiatry. I was pregnant then and really got to see life from a different lens in pregnancy, but also worked in the women's mental health clinic. And so there was just this interesting dynamic that I, got to experience. And so I did a lot of work in women's mental health. And when I finished residency, I opened my own practice and I saw a lot of women who were pregnant and postpartum. So I've been in practice for some time now, and these women have become perimenopausal. And so it's really, working with these women in my practice that have shown me what my gaps are and what I haven't learned. And so I've really taken, the time and the interest to learn so I can help them further. And that's where my expertise is in the hormonal transitions, but also just treating women throughout their adult lives.
Well, I think this is so needed. This is an absolutely needed field. I think there's a huge gap in this field.
Yeah.
Have you noticed the same thing with women not getting accurate diagnoses for perimenopause?
Absolutely. So I think there's a gap at so many different levels.
Yeah.
As a psychiatrist in general, the reason I really focused on women's mental health is because when women were seeing general psychiatrists, they were often dismissed out of maybe fear of treating pregnant women or not understanding the hormonal piece around periods. But there's often a dismissal, and women just were silenced by the stigma. And so, I think that really translates into perimenopause and menopause as well. We see that women come in more educated than the doctor sometimes. And honestly, it's the fault of the system, right? I don't blame any providers. It's really, we didn't learn a lot about perimenopause and menopause, and we really need to learn now.
Yeah. From what I understand, most providers don't get training on perimenopause and menopause in med school. Was that your experience as well?
Yes, absolutely. So we did not get any training. Maybe we learned what the word menopause means. And then, you sort of expect it in your OBGYN residency. And I don't think I saw any perimenopausal or menopausal patients. It was truly just, pregnancy, postpartum, contraception.
Yeah, I didn't have any training either. Whenever I got, my degree, my license, I mean, even working in a space where I deal a lot with anxiety and depression in middle-aged women, it just wasn't even talked about. I didn't even hear the word in my training. Yeah.
Yeah. And, that's when I was seeing patients, if I would say the word perimenopause, often women were like, can you explain what that means? And so, I just don't think that we use the word as much until now, which is exciting because there's really a movement to use the words that are appropriate to describe what's actually going on versus, you're just getting older and it's just menopause and that's just what happens.
So I'm curious for you, there's this volatility that happens in perimenopause. So whenever you see clients, you see, patients that come through your practice, where do you see the most turbulence? Is it in perimenopause? Is it in menopause? Where would you say that you're seeing most of the distress happening?
Yeah, so the most vulnerability for women is actually in perimenopause. And that's because we have the most unpredictable fluctuations of hormones at that time. So we actually have some good news when we are starting to hit postmenopausal period, usually the symptoms are improving
Okay.
for many women, but it's during perimenopause that we see the most active symptoms.
Yeah, that's been my experience as well. I mean, it just is so chaotic, not just in my own life, but with my clients during that period of time. And it can last a really long time. I don't think women realize
Yes.
how they could be in perimenopause and how early it can start.
Yeah, I think because we try to put things in a box. The average age of menopause is 51 and a half in this country, right? And that's when you haven't had your period for a year. And perimenopause on average is 4 to 7 years, but can be over a decade for other women, right? And
Yes.
so that's just looking at averages. And of course, as we know, there are other times that women hit menopause in different ways. So, for example, if a woman
Mhm.
had a surgical menopause because they had surgery that led to them no longer having those hormones that like estrogen, progesterone, that's a surgical menopause and they can have very similar symptoms.
Absolutely. And, at least now I'm finding that with the surgical menopause, that a lot of women are at least getting a conversation around, hormone replacement therapy. Whereas I can remember, what was it, about 8 years ago in a women's group, there were women there that had had surgical, they had had their uterus and ovaries removed, right? And they were depressed. They didn't feel well. And, none of us were trained back then. So we didn't even know what was going on.
Yep.
They hadn't had those conversations. Their doctors hadn't talked to them about that.
Those conversations are starting, but I will still say that they're not always there. I think it really depends on where you're getting your surgery and treatment, et cetera. And that's the important piece, right? Like we have to help women from all angles. We need to educate physicians, but also women so they can ask. I think, there's just this inherent trust in the medical system. At this time, we're like really seeing the importance of patients needing to advocate for themselves
Oh,
because
absolutely.
it just doesn't work like that.
No, no. Okay, so feel about educating people on anxiety and perimenopause. What do you notice with anxiety? How do you see that coming up? What's happening with women? What's going on?
Yeah. I mean, I think it's so individual because, anxiety can manifest in so many different ways. So for some women, it's really irritability. They come in, they're like, I'm irritable. I'm like so much more irritable than I've ever been. And it's impacting my relationships. And that's how their anxiety manifests. So, there are different words for it, but it's coming from that
Sure.
place. For other women, they're having really acute panic attacks. So they're
Yeah.
having these, distinct periods of just like sometimes even waking up in the middle of the night with these panic attacks.
Mhm.
And then there are other women who are just, more worried all the time. I think women tolerate a lot. And so
Yes.
they sort of like chalk it up to, okay, this is just what it is until there's a decline in functioning. And if I can tell women out there, one thing, it's like we don't have to wait till our functioning is impaired. If something's off, like let's talk about it because it takes a lot for many of us in terms of when our functioning is impaired.
Well, and I think even for educated women, sometimes we don't even realize what's going on. Especially, has your experience been that even women who've never had anxiety before can get it? Even women who've never had panic attacks before can get that during perimenopause?
Yeah. And the general patient profile is usually just like a 47-year-old female who comes in, who's like, I've always been, mentally healthy. Yeah, I've been a little anxious here and there, or, I had to like go to therapy for a few sessions, but overall I've been fine. And now I feel like my life is falling apart. I can't get
Yes.
myself together. I don't know what's going on. And, you ask the right questions and very quickly, what's going on. It's very hormonally based.
Oh, absolutely. And I had a family member that ended up in the ER twice. She was perimenopausal and didn't realize it, right? She was having a racing heart. She was waking up in the night with panic attacks and had never had them before. It's really scary, when that happens.
Yeah. And it's not surprising, right? We see this in pregnancy too, where hormones shift and we see the impact in anxiety symptoms. And so it's not surprising. And yet people are surprised because we don't talk about it enough in that time period.
No, we don't. I know I didn't get any of those conversations.
Absolutely.
What are you noticing since, you do the whole spectrum of women's health? What are you noticing when women are having children during life? Are you noticing anything like if they're in their late 30s, early 40s when they deliver, going straight to perimenopause, like after they have the baby, almost like they don't Sometimes what I hear is I just don't feel like I'm myself again. Like I had the baby and I just didn't bounce back. What are
Yeah,
your thoughts on that?
it's a very new area of sort of thinking, but we see it all the time.
Do you see
And,
it?
I
Okay.
think a lot of us think or have thought that it's more related to just the age of women as they've
Mm,
had their babies. So, right, a lot of women are having their babies in late 30s, early 40s,
mm,
which is around the time they may have gotten perimenopausal symptoms. I think it's going
mm.
to be very interesting to do research on this to find out,
Yeah.
is it that their postpartum period is sort of flipping them, for lack of a better word, into
I
that
see.
time,
Okay. Yeah.
making them more vulnerable, or was it sort of going to happen that way anyways? But we have seen this in our practice as well, where a woman delivers and then she doesn't quite get back to where she
Mhm.
was and is in perimenopause. And that can be quite startling for her, right?
Absolutely. Yeah. I mean, because, childbirth for a lot of women and delivery and the adjusting to the new baby, the postpartum, I mean, that's a big deal. That's a lot to go through. Yeah.
Yes,
As you know,
exactly.
right? Okay. So now let's talk about depression. What do you see with the correlations between depression and perimenopause and menopause? What are you noticing?
Yeah. So it's the same idea. We see it more in perimenopause than we would in postmenopause. That's going to be the higher vulnerability. And, when we look at depression in general, like a major depressive disorder, there's certain
Mhm.
symptoms we're looking for, right? Are they having low mood? Are they having difficulty getting out of their house because they're not interested in things anymore? Do we
Mhm.
find that they have low energy? Maybe their sleep is affected. So we see a lot of these similar symptoms. We generally don't see, or I should say, not always are we going to see the depth of sadness. Sometimes it's showing up with a little bit more anxiety
Mm.
or, the feeling of losing your identity and feeling restless, as well as having low mood. But
Mhm.
I think, this is where the nuance becomes really important. Where is the hormonal piece
Yeah.
versus the major depressive disorder?
Well, this depression and anxiety that women get, what kind of help can they get? What are treatments for this when they're in perimenopause?
Yeah. So, there are some women who have had previous histories of depression and anxiety, and then in perimenopause, their symptoms are exacerbated. There are other women who have never had a history and it's a new onset. If it's related to perimenopause, which is not always easy to determine quickly, I mean, there's a nuance to that, but if it's related to perimenopause, absolutely, we want to consider hormones if they're a good candidate for hormone replacement
Yeah.
therapy because we're
Yeah.
attacking the root cause, right? I
Yeah.
mean, I can throw medications at you all day long, but if it's
Mhm.
because of your estrogen and progesterone being low, maybe even testosterone, then
Mhm.
let's address that first.
Mhm.
And so I will say it's sort of like a Venn diagram. We have some women only on antidepressants, anti anxiety medications. We have some women who are only on hormone replacement therapy. And then we have some women who are on both. And there is some good data to show us that the estrogen may actually help the efficacy of our medications as well.
Yeah, I've seen that data. It's so fascinating that the incidence of needing any kind of medication for depression and anxiety actually decreases if a woman gets, HRT, right? If it's the root causes, the perimenopause or the menopause,
Correct.
right? And she gets that treated, then if she still needs the meds, right, it might be less or in some cases not at all.
Correct.
Is that true? Okay, you found the same
Yeah,
thing.
so it really depends on the patient. I think, we don't want to villainize psychiatric medications because
Right.
they save lots of lives.
I help lots of
But I
people.
think it's,
Yeah.
yeah, it's really just comes down to like, let's treat the root cause, right? For anything we do, we want to make sure we're treating what's wrong. And so this is where, doing a really detailed history and really understanding when the symptoms came on and how they're showing up and what other, associated symptoms a woman has can be really helpful to understand, what is she experiencing and, what treatment can she benefit from.
Okay, great. No, that's fantastic.
So I know we talked about medications. I just want to make sure we also remember there are so many other treatments outside of medications, right? So I really treat women holistically. We talk about therapy and, that's for depression and anxiety. If we have mild
Yeah.
to moderate symptoms, it really can be as effective as medications sometimes. And there are certain therapies that definitely have more literature, like cognitive behavioral therapy or
Mm,
CBT. But then at the same time, there are other things that have shown really good results as well, like exercise, for
mhm,
example, nutrition. And so,
mhm.
I really try to offer my patients a a plethora of options to see what really fits for them, and to give them recommendations based on what they're experiencing.
I think that's so important, right? Because HRT is super important and it's also not a cure all, right? Yeah.
Correct.
Right. So, the therapy, the exercise, putting healthy foods in your body, because I mean, we are aging. So, our bodies are, we still need to be, you know, more aware, right, of how we can optimize our life. And
Absolutely.
then, I find sleep is so important. And that is something that really gets disrupted in us.
Yes.
What are your thoughts on the sleep?
So I think sleep is a medication, right? And I'm putting in quotes like
You
this.
need to
This is
prescribe sleep. Yeah.
what I actually will write on my prescription pad sometimes, like you need to sleep. And it's because it's going to exacerbate all our symptoms. And like, I mean, you said it, in perimenopause, sleep can get disrupted, which means that can exacerbate our other symptoms or even like lead to a prolonged period where you're going to have those symptoms. And so again, I can throw a lot of medications at you, but if you're not sleeping well, that's not going to help. And this is where if hormone replacement therapy or other medications can help with sleep, depending on the root cause, if we treat the sleep, the other symptoms generally get better as well.
Well, I think this is so important because, in the American culture, it's so go, 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 right? And maybe it's gotten a little better, but I can remember growing up and it's like, okay, well, how many hours did you work today, right? If you're not working a whole bunch of hours, if you're not, pushing it to the max, to the limit, then you're not like a productive person in society.
Yeah.
And,
That's the problem for perimenopausal women, right? Because a lot of them experience cognitive issues as well. And
yes,
they're experiencing brain fog and
yes,
ADHD or ADHD like symptoms. And
yes.
so they are not as productive. And relative to their old selves, in quotes, right?
Mm,
Relative to that, they feel like they're failing. And so there is this conversation we have about like what are realistic expectations versus, you have to go, go, go all the time because right now your brain is changing based on the hormonal changes. And
mm,
how can we meet you where you are, which is so
mm.
important because there's no, medication that just makes that all better overnight, unfortunately.
Right. Right. And the brain is changing. I don't think that most people realize this, but the brain is actually changing. Can you say a little bit more about that?
Yeah. I mean, if we look at estrogen, for example, estrogen is thought to be like a hormone that's just related to reproduction. But if
Yeah.
we look at it, we have a lot of estrogen receptors in our brain. And in
Mhm.
perimenopause, actually, we have been shown to have more estrogen receptors pop up because we have less
Right.
estrogen. And so our body's
Yes.
actually trying to adapt to that. But it's showing you that, our body is trying to adapt. And for some women, it helps. And for some, it doesn't. But the idea is like our brain is actually a dynamic organ that is adapting to its environment. And we want to protect it in these environments. But when we have lower estrogen, actually, it also impacts serotonin, which affects oxidative stress. So there's so many nuances to this. But yes, to answer your question, there are brain changes, real brain changes that occur. And Lisa Mosconi, who's a researcher in New York City,
Yes.
has done phenomenal research about this. And we're finally looking at women's brains throughout perimenopause and menopause and getting information that is now much more tangible than ever before.
Oh yeah, I love her work. I
Yeah.
mean, she's literally putting people and their brains, women specifically in perimenopause, and scanning their brains had never been done before.
Yes. Yeah. And we need that information, right? It helps us understand what's going on. And that's why we can say estrogen is also a brain hormone now. We understand that it impacts us.
Well, and I think that shifting out of that sex hormone piece, right? Or that hormones are gendered. Women have estrogen, men have testosterone. But really, all bodies have all the hormones, right?
That's right.
And it's everywhere. It's not just your sex hormones or your reproductive organs, it's all
Right.
over your body.
Yeah. And I think that took us a long time to be able to say so easily, right? I mean, it's just for so
Yes.
long, that's what we've learned. Estrogen is for women, testosterone is for men, and that's it, just as sex hormones, and that's it. And now we know that it impacts us in so many different ways. And I always tell women when we're talking about perimenopause, this is why we have symptoms from head to toe.
Well, and I think, some women, maybe they get on board with the estrogen and the progesterone piece, right? But then they're like, oh my God, I don't want to do testosterone, right?
Yeah.
I don't want to, I don't want to have a man's voice. I don't want to get, big and muscly.
Yeah.
And so what do you want to say about that? What role does testosterone have for women and their brain health and their overall well-being?
Yeah. So if we look at estrogen and progesterone, I think even with them, we have quite a stigma. But when women have tried estrogen and progesterone, if they're seeing the benefits there, then they usually are more likely to trust their provider to actually try the testosterone. We're using testosterone at a much lower dose than what men would use it at. So one tube that they might put on in one day, we're using over 10 days. And again, we're not trying to exceed what our normal testosterone level was. It's really to just get us to the level that we were at. And we've seen really good data and patient stories about impact on memory, libido, obviously, and we have data there for women, and how they feel, just their energy level and the brain fog. And so I think there's just a lot of promise there for testosterone. And we just need to keep advocating that it's not just a sex hormone. It's not just a male gendered hormone.
Yeah, and I like that it's starting to get talked about, and trying to get an FDA approved testosterone for women, like an FDA approved, because we don't really, from what I understand, we don't have one. We don't have like, here's a female dose, right?
Yeah, we don't. And, there was quite a lot of research of testosterone on women that had really great results. And when it came before the FDA, and this was years ago now, they said, well, we need 5 more years of data because these are women. And I think they had already put in like $1 billion into the study. So, there's only so much money to put into this.
Sure.
Unfortunately, that has limited the ability to get it FDA approved for women. And I think it really halts people from wanting to prescribe it if they're not comfortable with it, because they're like, but it's not FDA approved for women. But, really, as physicians, we use non-FDA approved, or medications for non-FDA approved reasons all the time. And
Sure.
so this is no different.
Okay, so can we talk about ADHD?
Sure.
Like, I have been recently diagnosed because I was so overfunctioning in my younger years that, I'm a female, it was missed. And then in perimenopause, one of my best friends, she's a psych nurse practitioner, and she's like, hey, I think you need to get screened, right? So it turns out, okay, yeah. And it's like so many women don't realize that they've flown under the radar, right? Because they found ways to overfunction, and then perimenopause hits, and it's like,
Yeah.
can't find my keys. I put the cereal in the fridge, the milk's in the cupboard. I'm missing appointments, or I forget to send an email. So what can you say about that?
Yeah, I think it's really a hot topic right now, and for multiple reasons, right? I think women are finally feeling seen and heard. And I will say there are multiple reasons for it. So one, I think women, as they see their children get diagnosed and they realize they have similar symptoms, there's this like light bulb that goes off, and it's like, wait a second, like I had that same thing. Why wasn't I diagnosed? So I think there's some women who have really had symptoms all along. And, there's been controversy about adult ADHD for a long time. Like, does it even exist? We know that women can experience or have ADHD diagnosed later and not have had symptoms when they were younger. But I think because there's some pushback on that, women sometimes don't go get evaluated or treated. Now we're talking about it much more openly, so that helps. I will say in perimenopause, we know there are cognitive changes. And so cognitive changes from perimenopause versus ADHD, just like major depressive disorder versus perimenopausal depression, there are certain nuances to that diagnosis, and then the treatment would vary because we're looking at what's the root cause.
So would it be the same like with anxiety and depression, that for some women, HRT would help the ADHD?
So I think it would help some of the symptoms. Right now, if you had a full diagnosis of ADHD, that like if you had a proper diagnosis and that's what you've had, since you were younger, I think a stimulant's going to help you, right? But I think when you hit perimenopause, if you have an exacerbation of symptoms, can you go up on your stimulant? Yeah, that's an option. But probably you need something that's impacting your hormones, because that's what's leading to more of the symptoms, not that all of a sudden your ADHD decided that you need more stimulant. So it's not a coincidence, right, that we see the symptoms worsen. And I should say, we're also not surprised because we know that estrogen and progesterone impact and modulate serotonin, dopamine, acetylcholine, all these neurotransmitters that are in our brain that do have an impact on emotional regulation and cognitive processing and executive functioning, which are important for ADHD. I mean, which are what impact ADHD. And so we know that as these hormones are changing, that we're going to see symptoms cognitively. it's no surprise.
Is there a way to tell a difference as to whether or not the ADHD is a symptom of the perimenopause or if it's really a true diagnosis, like a woman has had this for most of her life? Is there a way to tell the difference?
So there's not like one clear data point that we can look at and say, oh, this is from
Okay.
perimenopause. This isn't. I think it's about when it started. What symptoms are you having? Where are you in, your sort of journey? I think there's just, what's the family history? I think there's so many there's so much we can gather from the history that would help us make that decision. I wouldn't say it's just clear. Exactly.
Yeah. And I think that's what happens in perimenopause is it's kind of muddy waters, right? It is a new onset. Has it maybe been here before, but maybe a lot less? So, women found, workarounds to
Yeah.
function in life. Yeah.
And I think what happens is this is why for so long women were just going to different specialists, right? Okay, I think
Oh,
I
yeah.
have to go to a psychiatrist. I am having some palpitations. Let me go to a cardiologist. I'm having
Yes.
right. And so I think we just need to also have a menopause specialist on board for every woman who can really like bring this all together.
Yeah. Oh my gosh. That's exactly what women need.
Yeah, that's the dream.
Okay. So, you're doing a talk
I am.
later today. Okay. Can you tell us a little bit about what your talk is going to be about? Because I think this is, really interesting and a topic that a lot of women need to hear about.
Yeah. So I work with the Peri Academy, which Peri is this amazing app. If you haven't heard about it, not for you, for your listeners, of really focusing on perimenopause. And we are doing a talk that is about trauma in perimenopause. And it's a topic that really we find is just doesn't have enough attention. And most women will experience trauma in their lives at over 90%, which is, really important for us to address it because it's going to impact how they experience perimenopause as well.
Can you say a bit more about that? How does trauma, like, can you talk about big T versus little T trauma and how that might impact someone?
Yeah. So when we talk about big T versus little T trauma, I think there's this assumption that you have had to experience a major trauma.
Yeah.
For example, like abuse, or a rape to say that I have had a trauma.
Yeah.
But there's trauma, like in so many things where we say, yes, there could be a major trauma and there also could be little T traumas or less major traumas, but they can still impact you. So for example, if you had a very unstable home life, that can impact you. And so it impacts in multiple ways. So there are brain changes that occur. There are physical symptoms you experience in perimenopause that can make you feel like you're reliving some of the sleep disruption from perimenopause can absolutely impact how you experience trauma during the menopausal period. We know that there are life stressors, right? So let's say you're caring for an aging parent and your trauma is coming from that. Like having to re-experience that trauma can also be there. And it's awful, right? When you have this perfect storm of how that can come up, I think we see women who have had trauma have much more significant mood and anxiety symptoms during perimenopause. That has been established. And it affects the brain. It affects the limbic system of the brain, which is where we process emotions, we process cognition. Those like the amygdala, the hippocampus, those parts of the brain. But the idea is like, if you aren't able to process your emotions and you're not able to think with the rational part of your brain, you are just not experiencing reality during perimenopause. And it becomes very challenging as you sort of balance all of these things.
Well, and it's so fascinating, right? Because we're now getting more data that emotional traumas can affect our physical bodies, our brains, right? And so, like when they came out with the whole ACE score, they were looking at how do these, traumas from the past actually impact the rate of disease, So is there any correlation between an ACE score and a woman's difficulty with perimenopause and menopause?
Yes. So childhood trauma absolutely impacts, how women do during perimenopause and menopause. And I think you brought up a really good point, which is that, why do we even talk about this to begin with? Okay, women suffer a little bit more. Yes. And when we have this, it leads to chronic medical illnesses, which actually increases mortality. And so we're talking about something much more significant than a little discomfort. And that's why we talk about trauma and perimenopause and how it affects women. And for so many women, they don't realize that. So even just educating them on this is a big step.
Well, I think it's so huge, right? Because women, no, this is my belief, right? Is that most women experience little t trauma in life, right?
Yes.
Either
Yep.
from, childhood, from not being seen and heard, because, they're a woman, from having to learn how to keep themselves safe in the
Yep.
world, right? All of the mental energy that goes along with how am I even going to walk safely to my car at night? This is, something that most men just don't have to think of
Yeah.
because they're safe. They don't have to worry about, do I have my keys in my hand?
Yep.
Did I park under a street light? Do I have my phone in my hand, right? Am I scanning the environment? Am I wearing shoes where I could run? They just don't think about that.
Yeah. That is
And all of
absolutely.
that is added stress, or maybe even, being somewhere and having uncomfortable things, said to you as a woman walking down the street being catcalled, right? Like this was a common thing that happened in the 80s and it was in movies and it was kind of just what was expected. And it's like, but that's wildly uncomfortable, I know I walked different routes because I didn't want that to happen. Other women, pretty much any woman you talk to in their life has had inappropriate comments made or innuendos throughout their life, and that does not feel good.
No, and their perception of that and how it impacts them, right, may very well be their trauma and additively, right? If we say like that's happened to them this number of time, like that is something that stays with them. And there's this
Sure.
great book, I'm sure you've heard of it, The Body Keeps the
Oh,
Score.
I love The Body
Right.
Keeps the Score.
Yeah.
Yeah.
And I don't necessarily recommend everyone read it. It's very research heavy and it's very triggering
Yeah.
for women, but I think just knowing the title is so powerful because
Yes.
anything that happens to us in our lifetimes from the time we are born impacts
Yes.
us. And so I
Yes.
always say, to my patients, like, oh, that happened and you think it's gone. Like you may think it's gone, but your body, your brain remembers it.
Right.
And that is exactly what we're seeing in perimenopause too, and how trauma is showing up.
So what would you recommend for women, right? Who they're like, yeah, I'm pretty sure I've got some little T trauma, or I'm not sure that I have it, but I think I might. What are their options? Where can they go to get some help for stuff like this?
Yeah. I think it's, first of all, it's so important to be able to acknowledge that, right? Okay,
Yeah.
something is there. I think depending on how distressing it is for them, there are different treatment models available. But I always say, like, start by journaling, see where your pain points are, right? I mean,
Yeah.
where does it really impact you? And then I think really the next step is like, do some therapy. I mean, I think everyone should be in therapy, but I'm a little biased. But I think, it's just figuring out, I shouldn't say figure out. It's just recognizing that we don't need to sweep these things under the rug. Let's
Yeah.
process like we process anything else, package it up, and have our narrative created and stay in our brain so that it is not going to impact us when we don't want it to, like in perimenopause. And then all of a
Mhm.
sudden it's coming out, in
Mhm.
ways that we don't even realize. Like I've seen women who come to me with really bad neck pain. And
Mm.
really, it's their manifestation of trauma
Yeah.
that has been unhealed, right?
Yeah.
And that's so important for women to recognize that, like, there are ways to talk about your trauma, to process it, and doing it with a professional can be really healing.
And there's some really great trauma therapies now,
Yes.
like, EMDR is a really great one. I do polyvagal theory and I also do part memory. But I think EMDR is the one that is evidence-based. People really know about it. What are your thoughts? What are some good therapies that you would recommend?
Yeah. So I love EMDR. I mean, I would say, therapy is so powerful for these
Mm.
women.
Mhm.
Not every woman can handle EMDR, but I think for those who can process their trauma there, it's very effective. Somatic processing can
Oh,
be
somatic, yeah.
really, yeah,
Yep.
really effective. Maybe some psychodynamic psychotherapy, depending on the patient and how significant the trauma is. But I think
Mm.
there's many different modalities that can be
Huh.
used that can be really useful for these patients to just take the load off. We just carry our trauma everywhere.
Well, we do, and sometimes I find, women having someone that just bear witness,
Yes.
to the difficulties that they experience daily and continue, right? Because we still don't live in a world where there's equality,
Yeah.
which is really unfortunate. And just having that acknowledged because I think so many women just take on the mantle and bear the burden of that, and they don't even realize that they've taken on the mantle. They've borne the burden of those inequalities their whole life. So when they get around other women or they're talking to someone who's loving and compassionate, it's like, "Oh, wow, I'm not alone here."
Yeah, I completely agree with you. And I think for a lot of women who have little t trauma, it's bearing witness and for some of them to validate, right? Because
Yes.
they've been told all their lives, like, but this happens to every woman. Like, this is
Yeah.
just your shorts were too short or
Yeah.
whatever, and
Right.
unfortunately, like this becomes the narrative that they've then created. And yeah, we can do better. And so I think I want it to be validated for women. I want them to know that,
Absolutely.
yes, what they're experiencing is real and that it's not just in their head and it's not them looking for attention.
Absolutely. 100%. Yeah. And then I find like in midlife, it all just comes together like this perfect storm, right?
Exactly. Yeah. And this is where we see, women are getting more confident because they know they've handled all their lives.
Mm-hmm.
But at the same time, it feels like their bodies are failing them, right? They don't trust their bodies the same way because it's not showing up the same way that it used to, and they're confused. So there is just a lot of, unpredictable dynamic here that women have to sift through. And I think having a community, not just of providers, but a community of friends and women
Yes.
stand is so important as we go through this process.
Well, and I think you hit the nail on the head because it's like this whole confidence piece, right? So women are usually at their peak in their careers and in their lives, in their mid 40s. And then all this perimenopause starts happening. And I find they lose their confidence. They're like, maybe I'm having a hard time finding the right word because I'm in perimenopause or, I don't have the stamina. But it's like I'm worried about my job. I'm worried if I'm capable in the field anymore. Their confidence just really gets nailed.
I just saw it today, right? Like I have a woman who I've been talking to for years and, she's going through perimenopause and she's like, Dr. Raja, just forgive me. I'm not as eloquent as I used to be. It's awful. I feel stupid. And
Mm,
this is what's coming out of her mouth. That's how she's talking to herself inside. Right.
absolutely.
And
Yeah.
so it's this identity shift of like, I'm a strong, confident woman to, I'm incapable. And this is probably how it's going to be for the rest of my life.
Well, and what's interesting, with Dr. Lisa Mosconi's work, she's found that even with the brain changes that are happening, that compared to men, women don't have less cognitive ability at the same age, even with all the craziness and the restructuring that's happening.
That is true. But when you doubt yourself,
That's right. It's the doubt that creeps in.
yeah, I mean, it impacts how we show up. And this is why so many women leave their jobs
Yep.
and are not feeling as confident when they're, in senior positions because it's how they perceive themselves.
Well, and as we know that for women to get like in senior positions and to be in these leadership roles, they have to work harder. I mean, it's just, so they're used to having, maybe some perfectionist tendencies, or they've had to work a lot harder to get to those positions and to hang on to them. So, once again, more of that little T trauma up throughout their lives.
Yeah, absolutely.
Yeah. Oh my gosh, this has been so wonderful. This
Yeah.
information is so great. Can you tell people, where can we find you? Where can women get to you? There's so many women that need help. Yeah.
Yes, absolutely. So you can find me on Instagram at Dr.
Okay.
Harita Raja. I'll spell that.
Okay.
It's a DRHARITARAJA. And then if you're in the DC metro area, we have Bethesda Women's Mental Health, which is a group practice for psychiatry and therapy. And that's at www.BethesdaWomen'sMentalHealth.com or BWMHC.com.
Fantastic. And then what would you recommend? Like, let's say, so I'm way over here on the West Coast, right? We don't have you over here. So what would you recommend for women? Like, let's say they don't live nearby. How do they find a psychiatrist or someone who's really knowledgeable about this so they can get the treatment they deserve?
Yeah. So first, I would first and foremost definitely educate yourself, right? So you know what is possible and what's out there. I would say if you're looking for hormones or someone who really understands perimenopause, probably go on the Menopause Society webpage and see who's taken the exam and gotten the certification, just as a starting point. There's so many providers who haven't taken the exam because they've been doing this forever. But I think, as a starting point, and then that's probably the way you can ask for psychiatrists who understand the hormonal transitions. Looking for a women's psychiatrist can be really valuable because that's what their focus is in.
Okay. And you do some educational information on your Instagram as well. So people can go there and they can watch and learn.
Yes, absolutely.
Fantastic. Well, thanks so much for being here. I really think that women are going to get so much out of this podcast today. I really appreciate you coming on.
Of course. Thanks for having me. And maybe we'll do this again soon.
Oh, yeah. I mean, there's so much more to talk about, so would love to. Okay, thanks.
Of course.
Thanks for spending time with me today. I hope you found something helpful, validating, or just a little more human in our conversation. Remember, while I'm a licensed therapist, I'm not your therapist, and I'm not a medical doctor. This podcast is for informational and educational purposes only and does not constitute medical or mental health advice. For personalized care, please consult with a licensed healthcare provider or mental health professional trained in the area you're seeking support. You deserve expert guidance that's tailored just for you.